Thrilled to introduce Dr. Sophie Bell this morning, because she's going to talk about first aid in the summer for our pets. Now, Sophie is the founder of Animal Love Pet First Aid, and she'll tell you more about that, I'm sure, as we go through. And we'll hear about her passion for helping animals near and far as well, because she does so much, not only in this country, but also worldwide. So, Sophie, thank you so much for agreeing to join me today. So,
Thank you.
tell me a little bit, really, tell us a little bit of how your veterinary journey into holistic medicine began.
Oh gosh, that's a very big question, isn't it, really? So, I've been qualified around 15 years, and I guess the journey has just been a constant listening to owners and changing my views and, looking at results, seeing what maybe owners do and give to their dog or suggest, and then noticing that things can, little things can make a difference. It's not always just about the drugs, but there's also a look into like home life as well, environment, the things that the owner does with the dog too. All of those things are really important. They all feed into trying to make a diagnosis and trying to make sort of better for the dog. So for example, something like arthritis, yeah, okay, you could just throw an anti-inflammatory at the dog and that'll make them more comfortable, but it's not gonna, you're never going to solve the problem, but you need to make it a lot better. So some of these dogs are really overweight. Telling somebody that if they lose 10% of their body weight, it's the same as adding a painkiller, sometimes spurs people on to start working on that, and then saying to them, have you got slippery floors at home? Oh, I do. Well, then get some yoga mats and help them so that they can get up. So giving them lots of tips where they can look into, complementary things around just the conventional part. Have you used acupuncture? Do you go to hydro? There's so many things in veterinary rather than just the drugs. The diagnosis is the bit that we make, and that's important. But then the whole situation needs to be explored really beyond us sometimes as well.
Yeah,
So
and
that's
yeah, and that's the same in sort of human medicine, isn't it, really? And I suppose so many people, or so many veterinary surgeons and doctors are so pressed for time, and they've got to hit targets, that sadly, things are, tablets are just thrown down dogs and animals and stuff like that. Just sort of also
yeah.
on the financial side for the owners of the animals, isn't it, as well?
Well, yeah, I mean, you hit the nail on the head with time there. Time can be a big thing because sometimes getting a good history and exploring what the dog's environment is like at home and where do they walk and what do they do and, all of those things, that takes a long time to get those answers before, and so it's very easy to go in and go, oh yes, the dog is lame on its back left leg. But I want to know, has that been intermittent? Has it happened before? Because there's a really good chance that the cruciate ligament's on its way out. It's got cruciate disease, and therefore we need to explore that and talk about, should we start hydro? Should you look at physio? You should be adding in joint supplements. You should be looking at the weight and all of those things. But sometimes you're pushed for time, and you've got a lame dog, and your priority is to relieve its symptoms there and then. But it's very difficult time-wise to start going all the way back through the history of what's gone on over the years. And that makes the job tough actually at times. You
Yeah.
don't always have that chance.
Absolutely, and I think that's the beauty of my job, really, doing my one-to-one consultations with people. I've got hours with them, so I actually can dig deep and find the cause of behavioural issues and refer on to, veterinary surgeons or hydro or what have you, to help them through. Because yeah, if we get down to the root cause, we can help so much better, can't we? So that must be really frustrating for you, as a veterinary surgeon.
It is, but I have an outlet, and my outlet is then to create content that then aren't like covers the things that I would like to cover if I had the time. So, covering a webinar all about canine and feline dementia, it then means that in a consult, I haven't got 2 hours to go through everything they can do and what they're looking for and how to make things better. But I can create something that people can use as a resource, which then means, okay, you've been told your dog has dementia. You haven't had the time, because the time just doesn't really exist to spend that couple of hours, but you can go away and you can use tools like that to make you manage things better. So that's my way of outletting for the problem that I have.
Oh, that's marvelous. Because you've got a YouTube channel. Is that where they're all put, or are they on your website? All these.
So yeah, webinars on the website. YouTube videos tend to be sort of snippets of bits of information. What is nice on YouTube actually is if anyone has any children, young children, I've got loads of little mini courses on there for them about looking after animals. But for sort of an adult community, there's I always put snippets of little things that come up that I think are of an interest to someone. And it's literally just called Sophie's Vet School on YouTube. So I do that, but I have to say I'm very terrible at getting things out there really, because I use a lot of the time I use social media, and although social media is great, not everybody uses social media. So sometimes they miss out. So I do try to, if people have come and done a course with me before, I do try to email periodically. I'm not annoying. I don't, hassle all the time. To then give them, like, to say, oh, look, have you heard about this? Or have you seen this? And again, just always creating new things that I think, my next course I'm due to deliver is all about the diabetic animal. But so much in there. How do you urine test to see, if there's ketones? How do you body condition score, muscle condition score? What's important about the nutrition? So you've been diagnosed with a newly diabetic animal. All of that stuff you will not get, but yet it will make the quality of life and longevity of that life as well, if you could learn all of those things and how to do them.
Yeah.
But they take an hour and a half in a consult to go through.
Yeah, absolutely. So that's a fantastic resource. So people can find your courses on your website.
Yeah, that's the easiest way. So it's really simple. It's Animal Love, petfirstaid.co.uk. And I have lots of options on there for people. A couple of other children's courses as well that are quite nice for the kids to do. It's good for people, pet professionals and pet owners, because some pet professionals, they'll need CPD as well. So they can show they've done continual professional development, which is what they're aimed at. And there's a mixture, I take people from a very simplistic point of view to a lot more, not complicated. I like to think I explain things clearly to people, and I use, every time I do any kind of teaching, everything is very visual. You do a course with me, I don't just throw a bunch of notes at you. You have videos, narration, images, because it's important. I don't know about you, but I don't always find just sitting looking at a book I can take it all in. I need to see what it means.
So many people are visual learners. It's like see how it goes, have a practice yourself, ask some questions, and it's really difficult to grasp thing. I do, and I think many people do as well, just from a book. It's not in,
Yeah.
I need 3D and pictures in front of me. So that's, and also what I love about your work also is the fact you use just normal speak. There are no complicated words for you to get your head around, because again, they get my head spinning.
Yes. Yeah.
And so it's nice. You're talking to normal people who are able then to grasp what you're talking about and be able to put into practice without being bamboozled by great big long words that, quite frankly, only make the try and make the person who's speaking them look really intelligent. And honestly, it makes me feel exasperated.
It's exhausting. I remember studying for my vet exams, and that's how I think I learned that skill. I used to basically sit, look at the information, and then rewrite it in a way that I would understand.
Yeah,
So I would remove some of the, some of the scientific terms. Yes, I have to know those as a vet, or have to have those, but just some of the extra kind of jargon and words that were padding it out. And I would say, okay, so basically, and I'd literally write that down on a piece of paper. Basically, if I see this on a blood test, it means this, as
yeah,
opposed to, or and I learned that skill, I think, from studying, because it made me then go, yeah, okay, I get that now. So I had to almost take it, dissect it, and then teach myself that way, because
yeah.
I mean, I obviously, going to vet school is complicated, but I would say that I'm much more of a practical person and much more of a visual practical person than I am So, it's tough when you're studying for exams. Exams aren't really my forte, although I managed to somehow get myself through. but I'm much better with the kind of seeing and doing and interacting with the owner and the, like actually, I don't know. I find that sometimes, I did a lot of work for the PDSA, so very charity based, and there's not a lot of money. So I spent much of my years learning how to diagnose basically from vision, smell, history, because we couldn't run a lot of tests because the finances weren't there. So you had to sort of really be sure, you definitely look like, a hypothyroid cat, right? I am going to use that money to confirm that diagnosis. You had to really kind of be in tune. And that taught me really great skills as well, I think. It was a great place to work and taught me a lot of good things.
Yeah. No, it again, like with dog behavior, it's about watching, understanding, drawing from all your past experience to try and get inside what's going on with the dog mentally, but physically, why they're doing what they're doing. That's fantastic. So if anybody wants to get onto Sophie's website and delve deeper, then you're not going to be bamboozled with science. You're going to get it straightforward facts and very entertaining and educational to be watching and be a part of. So delve in there. We'll put some information there for you later. But anyway, we digress massively, but it was lovely to hear all that. And there's so much more about you, about your trips abroad and everything. That will be for another time. Otherwise, we'll be here for hours. We're talking really, I suppose, about, summer first aid, but, summer in 2024, it's like, it's struggling, isn't it? But we do have the odd very, very hot day.
Yes.
And I suppose really people want to take their dogs out to the beach, to these lovely long walks or into town. But it's really important to know the signs of heat exhaustion. So what should people be looking at?
Well, I think it's important to know who's high risk. So high risk is any brachycephalic breed, so with a flatter face. They have multiple things that could be going on. I don't tar them all with the same brush, but what they all have is a tongue that's too big for their mouth. So that really obstructs airflow. So we can argue as much as we like and say, this one breathes really well and this one doesn't matter. It's still got a tongue too big for its mouth. So all of those dogs then fall into the high risk category. There's dogs that are not brachycephalic, like the Springer Spaniel, and he's fairly high risk up there as well. And he, for reasons really unknown as to why exactly, but he doesn't cope well with the heat either. Is the dog overweight or obese? Well, 2/3 of the dogs in the UK are, so that probably means that 2/3 of them need to stay at home. Are they elderly? So thinking about what is an old dog. So a 6-year-old Newfoundland is a senior dog. A 6-year-old Chihuahua is in the prime of his life. So also being realistic. But all those sort of dogs fall into this high risk category. They've got any heart or lung disease. And it very simply means that they shouldn't be going out if it goes from 20 degrees and above. There's no point risking it. Now, the signs that you'll usually see, so it starts with sort of heat exhaustion, like you say. Well, it starts with heat stress, really, first of all. And that's just like heavy panting, dark colour to the gums, fast pulse rate. And, the dog is a bit sort of unsettled. And then it can really move on to them then having some vomiting and diarrhea, usually salivating a lot because they can't be bothered to swallow because they're panting so heavily. And we get to end stage, which is heat stroke, which is unusual. We do see these heat stroke cases for sure, but usually at this point they're almost at the end, and they're vomiting and diarrhea. It's blood. They can have bleedings from their nose. They can have bruising to the skin, seizures. Most of them that I'll see will be in that heat exhaustion stage. So they're collapsed, they've got vomit and diarrhea, they're panting heavily, but there's a chance of bringing those back. The ones that are very severely affected, we have to use what's called rapid cooling techniques. And people always get like, we hear all the time about not using ice around dogs with heat stroke, but those with severe heat stroke have to be cooled extremely rapidly. it's very unlikely any owner or pet professional would necessarily be in this position, because I don't see many of these that are at that very end stage. But the idea is that we cool them with ice to get their body temperature down quickly, whereas everybody else can just be cooled gently with cold water. Don't cover them in cold wet towels. Let heat escape. Water on hairless areas, sparsely haired areas. Get a fan on them. Bit of sugar on the gums, so honey or jam, because the blood sugar normally drops. So it's quite a nice tip for you if they're very sort of weak. And I think if they have had vomiting and diarrhea and they do seem very drowsy, it's worth a vet visit, because most of those end up needing to go on fluids for, at least a sort of 12 to 24 hours to sort of, build them back up again, because the heat can do a lot of damage very quickly in animals, more so than I think we see in ourselves really in this country.
Right, yeah, interesting. And I suppose also heat stress can happen quite rapidly as well, can't it? Because when we see that temperature's going to be like 20 today,
Yeah,
that temperature is taken in the shade, not full sun. So
yeah, that's
that needs to be taken into account.
yeah,
And so that's something that I think a lot of people don't realise, that actually you can, full sun is can be an
yeah,
awful lot hotter. Um,
yes. Yes, it can, and a couple of degrees hotter. And they usually say anything above 24 becomes very high risk for all. And the bottom line is, it takes dogs around 6 weeks to acclimatise to a new temperature. And if so, people say to me, so you were saying about going abroad. I was in Cape Verde end of last year treating street dogs, and it was 30 degrees. I was with my sister, and she said to me, I feel really guilty taking these dogs out for walks. These were some in the shelter that she was letting out. She was like, because it's 30 degrees. And I said, yeah, but Casey, it's 30 degrees here pretty much all year round. It barely dips. They might have a bit more shade in the winter. Their class, their winter months, still 27. It's pretty much guaranteed consistent weather in that country throughout the whole year. So these dogs have climatized. But yeah, if we went to the UK and it suddenly went to 30 degrees and we started going out walking dogs like like she was doing there, then yeah, a lot of them would be collapsing.
yeah.
So it does take time, and that's why people say, I don't understand, why is it okay in other countries? Because other countries get a proper summer,
Yes. Yeah, absolutely.
proper weather.
Yeah, it's like, got a friend from New Zealand who lives over here, and he's got a coat on most of the time. When it gets to 30, he goes, "Oh, this is a good temperature," where we're just dripping.
Yeah,
Um,
yeah, it's what you
so
get used to, isn't
yeah, yeah, absolutely. So that's really interesting. It takes 6 weeks for a dog to acclimatise to a new temperature.
it?
So here in the UK, where one day we've got kind of 8 degrees and the next day we've got 20, it's like, as the saying goes, a dog has never died from not going for a walk.
Yeah,
There are many times that I will go out and not take my dog. I'll go to the beach or what have you,
yeah,
not take my dog, and feel I'm missing my, it's just like going shopping with that handbag. I
yeah,
miss take my dog, but she's not missing out in the slightest.
no.
Um, so the thing
It
is
is that
not to
guilty.
feel guilty. Us humans, we put such a lot of guilt onto our shoulders because of what other people think we should do, other people think we
Yeah,
should do, and you've just got to do what you know is best for your animal. And they're not going to go, "You've been to the beach, you meanie, I don't love you anymore."
well, you say that after I've done a night shift and I come in my scrubs, my three dogs, they sniff me all over and they're very angry. Where have you been? You know, why do you smell like that? They're very angry at me. So, but no, I agree. And the thing is as well, you've got to monitor dogs closely. I mean, although we have these temperature gauges and they say, oh, 20 degrees, 21, and it goes up, it's important to monitor them, because I had a young Sprocker Spaniel used to, like, when he was young, and technically he was slim. He was 2 years old. He wasn't like any heart or lung disease. He didn't fall into any of the sort of brachycephalic category, so he didn't hit any of the boxes, apart from, I suppose, he did have part Springer, and we do know Springers are slightly seem to react more to the heat. I took him out when it was about probably reading in the full heat, about 21, something like that. And within about 15 minutes, he was lying on the ground, didn't want to get up. And I was
Yeah.
like, oh my God. And that was just a prime example of, if I looked at the temperature gauge, I may have kept pushing him, because my partner was with me and he said, I'm taking him, we're taking him back. He's definitely struggling with this heat this morning. And I was like, he really is. And so then I made it a thing for him where I just took him out up to the woods on the cool mud in the evenings when it was like 18 or whatever, because he just never coped very well.
Yeah. Yeah, I suppose so. Regardless of age or breed or anything else, it's again looking at the individual
Exactly.
and understanding your particular dog, but equally so, don't take them out in the heat. So
Yes. Yeah.
for so if your dog is really, really panting, you know, dripping with saliva and definitely overheat, what's the first aid that an owner can do to help bring the temperature down without dropping it too rapidly?
So that's where you can use your cold water straight from the tap. It doesn't have to be tepid anymore. And so there's no point going for the main body area in a lot of dogs because they've got quite thick coats. I mean, yes, if you've got a French bulldog, a staffy, something like that, that's got is almost hairless, then wetting the body itself is fine. But I usually concentrate on the legs, inside the groin area where there's big blood vessels. There's a big artery running down the inside of the leg. There's lots of arteries and vessels and things running along the spine, so that's a good place to get wet as well. Inside the ears as well, I always find is nice because you've got lots of little mini blood vessels, so you can kind of get some water on there. So wetting the sort of sparsely haired areas, you could do more of the whole body if you've got a less hairy dog. Make sure you don't get their face in it though. I've seen cases where a dog's quite collapsed and someone's hosed them and the dog's ended up inhaling water, which is really dangerous.
Yeah.
So don't, make sure you keep their head out of it. Don't cover them at all. People always used to believe that a cold, wet towel is not the right thing to do. You need heat to leave the body. A fan is always a great thing, or any sort of form of flowing air, cool flowing air, especially around the face to really help them with breathing. As I said, a bit of honey or jam on the gums, because that when they collapse like that, they often have very low blood sugar, can make them feel quite weak. So you can just rub some of that straight onto the gum area. And then get your car prepared, really. If you've got air conditioning, great. Start cooling the car down.
Yeah.
Cold packs. So you can get ice packs and just wrap them in a tea towel and just place them around the dog's body. Make sure they can move away if they really want to. And then I'd make my journey to the vets. What I wouldn't do is have a collapsed dog suffering with heat stroke, bundle them into the back of the car. I'd take 5-10 minutes to try and stabilise the situation. Yeah. You need to begin the cooling process at home. Unless you were 3 minutes from your veterinary clinic, but most people have at least 20-minute drive.
Yeah, yeah. So the important thing is to walk your dog by water.
Yes.
Not out in really hot places, under trees, and things like that, and take water with you, because they need to drink as well.
Yeah.
as much as we do. Yeah.
Yeah, absolutely. They actually say during the hot weather, it's good to kind of up the options of where they can go to drink, because the more they're hydrated, the better. It's weird, but they drink, they hydrate themselves. That kind of almost, I don't know, cools the respiratory system as well. It kind of helps. The more water they have, it kind of cools the entire body. So it's good to encourage dogs to drink. But obviously, they're only going to drink what they want to drink. Dogs don't very rarely overdrink unless they're ill. They have very good sort of thirst, driven sort of thirst of how much they actually need. Unlike cats, who never seem to drink at all and just decide they're just going to send themselves into constant dehydration. But cats are another story.
Yeah, absolutely. So, no, interesting. We're talking about water now, because another subject I'd like to talk about is water intoxication, because you see so many people that dogs are in the water, they're retrieving tennis balls, whether that's at the beach or a river, and all the rest of it. And there are dangers associated with that, and also playing with hose pipes and things at home.
Yeah, absolutely. So you named 2 different types of things actually there, because if it's seawater, so if it's salt water, you get a different, a similar sort of idea, but different reaction to if it was, say, river water or hose water. So if you've got a lot of salt in the water, basically it's all about changes of electrolytes and substances within the brain. So it's all about salt concentration. So if you have, taking you back to like school days, if you have a lot of salt somewhere, it draws water in to dilute it. So again, if you've drunk a lot of salt water and you're very, very, you've consumed a lot, then it will often draw water out of the cells to try and dilute the salt that's there. And then those dogs often, it affects the brain. They go on, maybe have seizures and things like that. And equally, if they've drunk too much water, then they start to try and draw in more salt into the body, which they just don't have, or they start drawing it out of cells that need it. And then you start getting all these kind of changes within the body. So both ways can be dangerous. It's just about moderation. I never say to somebody, oh, that doesn't mean that you cannot do these things. It just means about, we don't want a dog, constantly sort of playing and biting and doing that with a hose for like ages on end. If it's a quick flick of the hose and they do that, and then fine. But also the other risk is as well, if you're doing that with a hose and they're jumping up and they're grabbing it and they're biting it, I would say one of the higher risks of that is developing bloat. So they're taking in water, they're taking in air, put a massive risk of panting because it's hot. You're setting that dog up, especially if they're a high risk breed, to get a bloated abdomen, and then that could twist. So I would say that you really, even short bursts of doing that, you have to be careful with those dogs. If they're really panty and they're really, you don't want a lot of air and water all kind of filling up the stomach all at once.
Gosh, that's fascinating. That's one thing I didn't know at all, because you'd also see people with these sprinklers that are going backwards and forwards for hours on end, and the dog's jumping through. So, yeah, top tip. Well, they're all top tips, but
I think it's useful. I mean, sorry, just to interrupt you. I was going to say just one last point around that as well. Some people put ice in the water bowl to keep their dog cool. That's fine. I'm not bothered about ice, and I'm not worried. I mean, all these. Yeah, if your dog's got poor dental disease and it chews an ice cube, it might fracture a tooth. But that's depending on hopefully your dog's got good teeth. But again, that's another story for another day.
Do dogs get brain freeze?
No, because people do seem to think that there's all these weird ideas about what ice could do to the dog. But the only thing I've ever seen as being a potential, again, is going back to bloat. So if you've got a dog that's really bobbing with the ice in the water and thinks it's a great game, and they're picking it up, putting it down, drinking more water and just doing this game, that puts them at risk of filling that stomach, a bit like the sprinkler hose situation. So it's about being careful of any of those things. I've got no problem with people crushing up ice, putting it into their dog's water bowl to keep it cold, whatever. That's it's fine. But what you don't want to do is really allow the dog just to be bobbing around with something, because that can be what increases the air intake.
Gosh, that's really interesting, Sophie. Thank you so much for that one. Because I know sometimes I'll put treats in some water for her to bob and sniff, and that's definitely completely out now. And if she's a little cocker spaniel, but still, you don't know, do you?
No.
It can happen to anybody. So yeah, thank you. But one I'm keeping you for ages here, but this is something that I've come across is people throwing tennis balls on the beach, and then tennis ball full of sand, and the dog's ingesting loads of sand. What problems can be associated with that?
So I've had first hand of this before. So we're going back now about 17 years. Before I qualified as a vet, I had a spaniel, and I took him to the beach, and I wasn't even throwing the ball, actually. He was just playing with it, digging, putting it down, pricking it up, like and we were there for quite a long time. And then took him home, and then I think I was at uni or something the next day, and a flatmate rang and said, oh, he doesn't seem very good today. He's really quiet, and I think you should come home and have a look at him. And he was sort of laid out flat. And it just so happened that he then just moved at that point, and the amount of sand that he threw up, I think I could have made the world's biggest sandcastle. And I was like, oh my goodness. I mean, I got lucky because he threw it all up. And then after he'd done that, he felt a lot better. I hadn't even considered, I think, so we're going back quite a long time now. I hadn't even considered it as a problem. I hadn't thought that digging in the sand we probably sat down on the beach relatively cool day, probably sat there, I don't know, 4 or 5 hours. I was studying or reading a bit, and he was just playing the whole time, doing that with the tennis ball. And I hadn't really even considered the amount of sand he could have ingested, and it was loads. So we've had a few where we've had to go in, cut the stomach open and spoon all the sand out. So that's sort of the, worst case, I guess. And the thing is that sometimes I suppose it's making sure that the owner actually realizes that that is what's happened, because the dog, so for me, my dog was just very flat out quiet. He didn't want to eat. He barely wanted to move. He hadn't passed any poo because nothing was sort of moving. I said it just happened to be, he sort of saw me. I think got a bit excited because I got home from uni or wherever I was, and then he suddenly got up, got excited, and then he went and sort of threw it all up. And I have never seen so much sand. It was incredible. So yeah, you're right. Over a period of time, it's actually small amounts over a long period. You don't really, so it's often better to perhaps remove the things they're going to dig with and chase after and grab, because then you're not going to keep getting that ingestion.
Yeah, absolutely. Yes, because my little girl, when we first came up here, it was sort of digging in the sand and all the rest of it. And what I noticed was she was having very, very solid sand poos, and I thought, I'm lucky there it's going through.
Yeah,
So again, on the beach, we don't do balls and stuff. We're running in the sea, and then we'll go and hunt for balls up in the dunes and things like that,
yeah.
rather than anything else. Because that, yeah, it's something that I'd never thought about before. And I was lucky, well, as you were. Your dog made a sandcastle front ways, and my dog made a sandcastle back ways. Yeah, it's been good. But I suppose to round anything off, those subjects that we spoke about are the ones that are a massive fascination to me. So that's why, and I think those are the most important ones for the summer. But when we're talking about a first aid kit, for to have just at hand in your car or on your walks in your rucksack, um,
Yeah.
are there some little items people can put together, or is there something that you can buy if you put something together that people can purchase that you find have got all the important things rather than the extra stuff that we don't really need?
Yes. Oh, don't get me started about first aid kits. They get padded out, with things that I think, what are you going to use that for? It's just an extra item to list,
Yeah.
and I find it very irritating. So yeah, I do. I've got 3 first aid kits, a mini but mighty, so it's quite a small kit. That these are all on my website, and this little one's only like £12, but it's got all the major things that you need out on a walk that you're going to really need. So it's got I don't know if you've ever heard of the brand What's Up. So it's a really cool, I've got one here to show you, little, about this big. And basically what happens is you push the middle, and it releases a wipe that's got apple cider vinegar on, and basically instantly soothes a wasp sting in a dog. So it's, got these really cool wipes. So if you're in a situation where, and actually can be quite useful on a variety of different sort of irritated areas. And I put, a couple of bandages, swabs, in the mega kit. I've got a mega kit. It's got arnica cream in it. It's got a thermometer in it. It's got hydrogel, which is a type of gel that you use, blood stop powder, because there are great powders that can stop external bleeding. Gosh, I put so much in that kit, I can't actually zip it up. I just, every time I have to rearrange it, this thing's getting bigger. So I got 3 kits basically, ranging from £12 all the way up to £55. And 55 is the mega with everything, but lots of products in that you're going to use, that are very, very much every day. I don't, as I say, it's actual stuff that you're getting, rather than just me grabbing a bag and throwing lots and lots of bandages and a few plasters in, because that's what really irritates me about first aid kits. And 2 of the kits, they come with a little guide, simple little guide. What can you use all the items for? But there's loads of bits in there. What you can do, you don't even have to get a ready-made first aid kit from me. You just go on, use my website as a resource. Go on, oh, what does she put in her kits? Make up your own. It doesn't have to be does not, I don't have to, you don't have to get it from me. You can start to design your own. You'll see all the items that I like. I have got, actually, as a little plug on here, a free webinar in July called Designing a First Aid Kit.
Oh, wow.
And it's free for everybody. I do get everyone to sign up on Zoom, and the reason that I do that is it just stops. I've done these things before where you don't get people to sign up and then you get them gate crashed. So I always set it up so that so we don't have any kind of badness going on. It's a free webinar in July called Designing a First Aid Kit, and basically in that I'm going to be going through a whole load of different things. Even things like, keeping chamomile tea bags in your first aid kit. Why? Because they're good for bathing eyes. They're also, a bit of chamomile tea can help with an uncomfortable stomach. They've got diarrhea. Really great for also just use like bathing wounds with, but just don't use it in cats. And all those kinds of things, like little extras that you have floating around the house. So not even stuff you've got to buy.
Yeah.
So that's the idea of that webinar. So people can go, oh, what can I use for this? Oh, I've got this in my cupboard. Oh, actually, that's really useful.
That I'll definitely be watching that. Thank you very much. I'm one that often forgets to take stuff with me. It's like with my second child as well. I forget to take nappies and stuff like that. She was dragged up. But fascinating. Yeah, and the interesting thing with everything that's in your first aid kit, you explain what they're for. Because so many times you open something up and you go, well, I just don't want to do what's that in there for? Why am I using that? So a very useful thing. And I say the little one is what most people would need, but be really interesting to watch your webinar in July. I'm looking forward to that. So thank you very much.
Yeah, just something simple. And also the idea of the webinar is to make you think about, where are you? So what might you need? So, if you're beach walking and there's lots of washed up jellyfish and your dog's very inquisitive about jellyfish, then you need to carry something acidic in case, because they can sting for months after they've died, that might need to help them. So, for example, if you've got a very inquisitive dog, there's a risk of them getting stung by a jellyfish, then one of those squeezy lemon juice bottles, stick it in your pocket, because if they get the tentacles on them, you're going to cover it in the lemon juice. That will help the tentacles slide off and also help with the pain. So it's about thinking about, where are you going? What do you need that you might have to use? Because you don't want to carry this suitcase of items.
No, absolutely.
Yeah. So I think, it's important thinking about what you might need.
Yeah, and interesting to know that probably a lot of what you need in your first aid box, as you said before, is probably in your kitchen cupboard.
Yeah, lots of things actually that you could just use or make do with, and things like bleeding wounds. At that point, I don't really care about sterility. I don't care about whether something is sterile. You just want to stop the bleed. You don't need to go hunting around the first aid kit to find something in date. It doesn't matter. You just chuck something on it and stem that bleed. You don't need to worry about it being perfect. And so there's sort of things like that, and again, it might just be that you use your kitchen towel. You haven't always got, and also who carries a permanent first aid kit around that if something happens, they've got it there 24/7. You don't. But say in what I do have is a lot of nice items that you can use to help with healing, with wound healing or, whatever it is they've had done, as well. I pop those sort of bits in too, sort of long-term stuff.
Yeah, that's lovely. Oh, it's been fascinating to listen to you, Sophie, and so look forward to having you on again. But for those who would like to tap into all this information you've got, what can you just let us know, remind us of your website?
Yeah, of course. So it's just Animal Love petfirstaid.co.uk, and you see all the bits on there, all the first aid kits I mentioned, the webinars, the courses. I do live courses as well. I do first aid courses in a classroom-based setting. I travel all around the UK. There's only one of me, so it might be that I only come to an area once a year, maybe even once every 2 years. So a lot of people, I think, get worried about online learning. Online learning with me is very different. It's very interactive. It's very visual. As I said, I don't just throw you in a situation of read this. people get worried about missing out on practical elements when it comes to first aid. Again, if you're in a classroom, great, we will do things like CPR and things. If you're on an online class with me, you don't need to worry about that, because I teach you how to do CPR on your kitchen table, because it's one of the best places, in fact, that I find to do it. And I think you get a better idea of how CPR feels hitting the kitchen table than you do the mannequin. So you don't miss out, because people get very worried about that. I still get you to practice something to help you at home. You're not just going to be, oh well, I'm just watching how it's done and I haven't got a clue. You will have a clue.
Yeah, that's brilliant. Lovely. Sophie, thank you so much.
No, thank you, Caroline. Thank you.
Fascinating to talk with you, and look forward to another chat in the future.
Yes,
So,
absolutely.
yeah. So bye from me, and
Bye from me.